like you who are doing great things in the world that I think you should know about. Well, today is the second Thursday of the month. I had to look, which means it's time for Vegan Doc Talk with Dr. Scott Harrington. He's going to answer your questions. Please welcome him to the show. Hello, Vegan Doc.
Hey, thanks, Chef AJ, for having me on. It's good to see you.
Well, it's good to see you again. What's happening in the fine state of, you live in Florida, right?
I live in Florida. It is hot, real hot in Florida. It's a,
Wasn't something else going on in Florida? I'm trying to remember. Something's.
um, there's always, they have that thing, Florida Man, where you can type in the day and the word Florida Man, and it'll come up with some hideous thing like, Florida man eats somebody's face, or Florida man throws an alligator in a Burger King or something like that. It's a thing.
Oh my goodness gracious. Well, so today you don't have a formal presentation like you often do. And if people want to see those, they're fabulous. They're on all kinds of different subjects like osteoporosis, weight loss. But today you're going to do some straight up questions from our audience.
Yeah, I thought I'd keep it open today, just to get people's questions. I
Well,
like being flexible.
they love it. So why don't we start with the first one from Christy? And she's asking about the research that is now saying we can't have a banana and a blueberry at the same time. What do you think about it?
Oh, this is the stuff that Dr. Greger had put out about uh, the bananas having an enzyme that break down polyphenols. And so this is kind of sad. I love Dr. Greger. I feel like if there was a Nobel Peace Prize or a Nobel Prize in nutrition, I feel like he should get it because, he's so bringing so much info out to the people. And I love him for that. But I'm sad. I'm sad because it's made me sort of avoid bananas at the same time that I eat like berries, for instance. So when I do, I love bananas. And when I eat bananas, I'm kind of eating them more as an afternoon snack or something like that. But I'm avoiding putting them with smoothies as the thickener that if it has berries in it. I've using things like mango, or papaya or something else, just to kind of, pineapple to kind of bulk it up. So, I mean, you have to believe the evidence. He gives a very compelling.
But tell me about the study and who did it, and I'd like to know a little bit more about the study.
Well, yeah, I mean, you could watch his video, but I mean, what he demonstrates is he demonstrates very convincingly that that the banana has this polyphenol oxidase, or a thing that breaks down the polyphenols, so that if you eat the banana with the berries, the beneficial polyphenols that are good for brain health, good as an antioxidant, good for all sorts of things, that it literally will lower the levels of polyphenols. And so it's
Yeah,
it's problematic.
but how is it
We want to
problematic?
maximize.
How is it problematic? How is it creating ill health in a country that eats, 67% of their calories from processed food, and you make it even harder for people to eat healthy? I don't understand how this is problematic, having a banana and a blueberry at the same meal.
Well, okay. So your point is well taken, Chef AJ. Like, why put up barriers? Why put up any kind of barriers to eating a healthy diet? And so this is about maximizing. This is about splitting hairs and trying to, really maximize the nutrition out of your meal, I guess you could say. But I mean, bananas have they're such a great resource in terms of all sorts of recipes and turning sort of foods. That are kind of unhealthy kind of desserts, and using bananas to make, nice cream and all sorts of, bananas are a great binder for, like, oatmeal cookies and things like that you can use. So bananas are a great tool. So I don't want to sort of turn people off towards bananas. It's a banana and smoothie concern, or bananas and berries at the same time, and it would just slightly decrease the nutrient content that you have available to you through absorption. Yeah.
Right. But like I said, at the end of the day, when we have a society of most people that don't eat well at all, how is that going to make an impact on our healthcare system?
Yeah, I guess it just should almost be a piece of knowledge that you keep under wraps or whatever. I mean, I don't want to have people avoiding eating bananas or eating healthily. Yeah, I don't want it to be a barrier to
Yep.
anybody.
Yep. Well, I'm still going to do it. The thing is I don't have a lot of smoothies, but when I do, believe me, that's probably my favorite combination, and I'm not afraid to do it. Okay, because I'm eating so damn much kale, I'm sure it's balancing it out.
Right, right, right. That sounds like that world's most handsome man like meme or something. I don't eat a lot of smoothies, but when I do.
You're funny. And gosh, you look like Tom Cruise when you did that. Okay. Well, thank you. So this question was sent in by Jody, and she says she has a son in Fort Lauderdale. Is that close to you or far from you?
It's on the other coast. I'm on the West Coast.
So it's not close. Okay. And he needs a primary care doctor. He's 34 and has hypertrophic cardiomyopathy and has an implantable cardio defibrillator. He has a cardiologist who's not very caring, just says, "You're healthy and doing fine." He just wants him to be on meds. My son is not vegan, but only eats meat a few times a week. He doesn't feel great and would like to have someone to ask regular medical questions to. I would like him to have a doc he could actually see, as he has primary care, but he doesn't have time to seek one out. And I live in North Carolina. There doesn't seem to be any vegan docs that I can find near him. Do you think telehealth would work in this situation? I'm very frustrated trying to help him. I love you and would love for you to be his doctor. Thank you and God bless. So she's asking.
Wow, super sweet, super sweet of you. Yeah, I can absolutely serve as his primary care physician. I started my practice doing primary care through telemedicine. And, it's not 100% ideal. I can't listen to your heart through internet, although they do have tools for that, Taito Care. But yeah, it's I could totally do it. Most of my patients are through telemedicine. And I do have a clinic in Pinellas Park, Florida, where I see patients 1 day a week. But I started this practice during the pandemic where people were willing to do telemedicine. So I would love to be her son's doctor, and I could, answer questions. And, if you have your primary care doctor through telemedicine, you definitely want to still have local specialists, or, if that's, and especially in this case, of course, you'd want him to have a cardiologist, local cardiologist, who could take care of many things that he would need. But a lot of times, the primary care doctor is kind of like the medical medical traffic cop, where it's like, this doctor recommends this medicine and this doctor recommends this medicine, or let me explain what this specialist had said to you, because they said it to you in passing and then kicked you out the door or something like that. That's kind of the job of the primary care doctor, is to be a teacher what better, if you're plant-based, is to have a plant-based or vegan doctor who could be your primary care doctor.
Right. Well, she says he isn't plant-based, but that the cardiologist isn't very caring.
Yeah. Well, I mean, you do get someone who's biased when you come to see vegan primary care. Dr. Harrington, of course, I'm going to encourage you to eat right, eat healthily, and to avoid animal products. But I know that some people aren't 100%, and we try to get them there. We try to help get people there. So I see a lot of family members who may not be 100%, and encourage them in a very non-judgmental and I perceive it to be, like gentle way. You're not going to get hellfire and brimstone when you come to Dr. Harrington. I've got to be encouraging. So I think I would be a good fit for them.
Thank you very much. This is from Alyssa, and she says, Dr. Harrington, I've been whole food plant-based for 4 years and try to eat SOS free. I was recently in the hospital because I had dangerously low sodium levels at 120 MEQ over L. I've had consistent low sodium levels in the past, but doctors didn't seem too concerned. How do I ensure I'm getting enough sodium to function properly? I'm struggling with the knowledge of how additive salt, sugar, and oil are, so I try to avoid them. Blood pressure is normal. I am a 34-year-old healthy, active woman at normal weight.
Okay, yeah, hyponatremia, low sodium. This thing it's a tough one. It is sort of the bane of the internal medicine resident's existence, is dealing with low sodium, because it's kind of a long workup. You have to do blood work and urine testing and find out the concentration of things, and you follow these algorithms to find out the exact diagnosis. I will let you know that oftentimes is not related to your intake of sodium, because it's the way your body's hormones, the antidiuretic hormone, and basically it's the way that your kidneys manage the salt that you have in your blood. And so a lot of times people will have some numbers a little bit off with the sodium in the chemistry test, and they'll see whether it was a little bit low. They assume it is related to not eating enough sodium, and then they'll go and they'll eat a lot of sodium, which is problematic. And so a lot of times it's related to dehydration or diarrhea or various things that can affect the sodium, the electrolytes. But a sodium of 120 is ridiculously low, is very low, and it's something that you need to keep following up with your doctor, keep getting the workup. You want to get the workup completed so they can find out what if there's a change with the hormones or a kidney problem, or things like maybe you're taking a diuretic that causes you to, something that is affecting the kidneys. So yeah, so severe hyponatremia is not something to play with. You want to work it up and figure out the cause, but it's not. It's usually not related to your intake of sodium.
So 120, is that how low? What is the number supposed to be?
I mean, in the high 130s or something like that. So 120, I believe. I mean, just off the top of my head, it's really low.
So, are there symptoms to this?
They could cause all sorts. I mean, if people develop it slowly, then it can sometimes go without noticing. But people can have cramping, people can have headaches and altered behavior. I mean, your electrolytes, just like your body keeps your electrolytes generally perfect, just like your temperature, just like your pH. And so you can have dramatically altered mental status if your electrolytes are off, because normally the body keeps them in this very narrow range. And so, yeah.
Perfect. Thank you. Okay, next question is from Keisha. Can you ask Dr. Harrington the quantity and length of time of vitamin D recommended for a level of 28.4? And is there a vegan vitamin D prescription?
Well, yeah, the vegan vitamin D3 is over the counter. I recommend my patients be over 30. So you're at 28. And so you're right there, considered to be close to normal. My baseline vitamin D recommendation for people is 2,000 international units. And so regular vitamin D, I've heard is actually not vegan because it's made with sheep's wool lanolin. I think they make the sheep's wool and they boil off the lanolin and they use that so it's an animal byproduct. So, but you can get it. I think it's related to lichen, some sort of mushroom. There are vegan brands and they're a little bit more expensive. But you just go on there's bunches of vegan brands of vitamin D3, and Natrello kind of comes to mind, Future Kind. There's lots of different brands. I don't like to say brands because I'll say one brand and the next day it's like they're not selling it anymore or something, but just look for the keyword of vegan and vitamin D3. 2,000 is the baseline, is what I recommend. And I don't have people go more than 4,000 or 5,000 unless they have severe deficiency, and then just for a short time.
Thank you. Okay. Do you know what amount do you normally recommend to people, or is it based on what their blood test is?
Well, if I don't know what the blood test is, I have people do 2,000 because when you test people in general, we spend most of our time inside. That's just how it is. So we tend to be a little bit low, and that usually gets them up close to the 30 range. But since she's already at that 30 range, I mean, that'll carry her over. And so I'm pro vitamin D. I know it's the sun vitamin and you could get the vitamin from the sun, but we also know about wrinkles and radiation from the sun. We know skin cancer. I'm super pale skinned, super prone to skin cancers. And you can see it. You can see it in your skin. Like right here, this skin is not really, crusted up by radiation. because it's kind of on the inside. But this skin right here, it's changed. I don't, you can't see here, but there might be little freckles, and over time you'll get rough skin. So the goal, my goal is when I go outside, I'm usually covered up. I'm usually using a mineral-based sunscreen on my exposed skin, using a big hat. My sister is a dermatology PA, and all day long she cuts cancers off people's face and she closes them up. And when she's like driving and stuff, she'll actually wear driving gloves. And you know, she's very, very paranoid. And I can only imagine like what she sees kind of brings that message home to her about the cancers. It just takes time and you develop it. Now, the plant-based diet, you think we might be able to prevent or decrease the number of skin cancers due to the high amount of antioxidants and things that we eat. And I think that might be true, but I still want to reduce that factor of the sun damage. So I'm pro vitamin D.
And you say 2,000, that's international units, and that's daily?
Yes, international units daily.
Nice. Thank you. This is from Luann. Dr. Harrington, my daughter suffers from severe migraine headaches about once a week. She's not whole food plant-based like me. I'm just wondering if a whole food plant-based diet would help to prevent migraines. Are they more of a genetic disorder? Her dad also suffers with them as well, which makes me think they're genetic.
There's probably a genetic component. Honestly, I don't know the 100%, what do you call it, where, I mean, what percentage of it is genetic, the breakthrough, I guess. But migraines are kind of tough. You want to check all sorts of factors. I mean, you look for their vision, you check for tension in the neck, sometimes osteoarthritis of the cervical spine, check in ergonomic situations, like, you know, are they sitting at a desk and has certain poor posture scenarios. There's lots of things. We're looking for clues when you have migraines. We're like, what is it causing? Is it high blood pressure? Is it one way to kind of consider it, if someone doesn't have a very good diet, maybe there's you know, getting on a high nutrient, getting on a plant-based diet that's high in nutrients, high in fiber, an anti-inflammatory factor that might improve her situation. So this is migraines is one of those illnesses. It's kind of like migraines and asthma and acne and some of these things that might have a significant lifestyle component. And so it's worthwhile to see a lifestyle medicine doctor. I mean, how's her sleep? Is she chugging caffeine all day and then staying up all night and doom scrolling on Instagram and then waking up early for work? And I mean, there's a lot of factors. They have had significant improvements with migraine treatments. We used to only have, you know, NSAIDs, but now there was triptan medications as needed, rescue therapy. But they had a lot of side effects. They've proven that ginger tea is about as effective as the triptan medications. But now they have new monoclonal antibody medications. And so if someone has really bad chronic migraines, I work with the lifestyle stuff. And if we have trouble with that, then I have folks go to neurology to see if they can get on some of these newer medications that might offer benefit. Believe it or not, Botox is a option for migraines. If people have like a lot of tension related headaches, Botox can, at various areas injected by neurologists, have reduced migraine frequency. And then there's also, you know, I'm an osteopathic doctor. We do like osteopathic manipulation, which is kind of like, in a way, you think about it, chiropractic type manipulation, where if someone's holding a lot of tension, and do some, you know, soft tissue techniques and various manipulation techniques to help reduce tension. So there's lots of things you could try. I would keep going back to the doctor to see if they can figure out a cause, and that would be the best thing.
Nice. Thank you. I have a question from a live viewer on Instagram, Eat Plants for Health NC. Is there something safe to put on a water blister that bursts on the abdomen?
Water blister that bursts. I'm a little confused about what was the cause. Sometimes friction, or usually you think of a blister like due to friction or like a burn, a bad burn. But if you're just developing blisters like spontaneously, that's concerning. You should go see your doctor, and they would probably refer you to dermatology, because there's like pemphigus. There's these weird blistering diseases. But so I'm not sure, whatever the cause is, if it's a simple cause like, a sunburn or like a friction type of cause, then, you can use aloe, but basically you want to avoid, get away from the friction scenario, or get away from the sun. And it's like self-limited. You just don't try not to touch it, try not to do much to it. If it opens up and you have the wound without that first layer of skin, I recommend Vaseline or Aquaphor, just to kind of cover it, to seal it. You'll get the most expedited healing in that scenario. And generally, I recommend not popping a blister, because you just create a larger wound, and you let it kind of pop on its own.
Unless the dermatologist does it.
Or if the yeah.
Because I remember I did the stupidest thing a while back. You think because you're a chef and, we're used to taking things out of the oven and getting burned. I don't know why, when I was microwaving some soup to see if it was hot enough, I decided to stick my finger in, and I got like this huge, like it was gigantic, and it was so painful. And so he did pop it, so like with a needle sterilely. And I wouldn't do it myself, but it did.
That's tough. That's tough on the hands, because you move your hands and it's
it was this finger, and it was it was, oh gosh, duh, stick my fingers. But anyway, it was nice that he was able to. Even if I could have done it myself, I wouldn't have wanted to. But it was anyway. It turned out fine. But yeah, I know how painful a blister can be. So this is not a question; it's a thank you from Trisha, who says, and she can't be there for the live show today, but wanted to pass this along to Dr. Harrington. I just had an appointment with him, and he is an amazing doctor. I am so lucky to have him as a doctor, and her last name starts with K, so maybe you know who she is, and she wanted to tell you how great you are. Unsolicited.
Wow. Thank you. Yeah, Trisha, I really appreciate that. I'm going to have all my patients come on to Chef AJ and tell me nice things. How lucky am I to have someone come on and say that? That is really sweet.
Yeah, unsolicited, I swear.
Great.
Okay, fantastic. So this is from, doesn't say Amunya, and Dr. Harrington. I recently finished 40 days of the starch solution. My total cholesterol came down from 260 to 202. My LDL came down from 156 to 135, and my triglycerides came down from 256 to 102, a whopping 154 points reduction in 7 weeks.
Wow.
Yeah, it's good, huh? My HSCRP was in the normal range. My APOB was normal, but two things were not normal. My homocysteine was elevated, and my lipoprotein A was high at 39. Is there anything I can do to address the high homocysteine or lipoprotein A? And is there anything else I can do to lower my cardiovascular risk, as is a very strong family history of heart disease?
Okay, well, first off, you have to sort of take pause and congratulate yourself and feel super proud and that you've made such huge headway. And so the first thing to do is to take pause about how far you've come. And you've already dramatically reduced your risk, your cardiovascular risk. And so, woo, so now we're just like, now it's just gravy. We're just vegan gravy. We're just, getting a little bit better. We're constantly improving, always forward. So with the lipoprotein A, lipoprotein A is this additional cardiac risk factor waiting in the wings. And it's kind of something that wasn't really paid much attention to a long time ago. And people with lower cholesterol were having heart attacks, but they realized there's this other factor, lipoprotein A. In general, they don't think of it as high until it's over 125. Although, I guess it's on a spectrum. It's on a spectrum for sure. But your levels in the 20s or 30s is considered low or normal. And so I would put that one to rest. I wouldn't lose any sleep about your lipoprotein A level. And that's kind of how we address it. We tell people there's lipoprotein, whether you have additional risk or no additional risk. And then at that point, we turn our focus back to the LDL and ApoB as the things that we could try to control, the factors that we can affect with medications or supplements or diet, So let's talk about the homocysteine. Homocysteine. Oh man, this one is tough. As a vegan doctor, we worry about B12, and then the test for B12, there's homocysteine and there's MMA. MMA is only related to B12, but homocysteine can have multiple sort of factors that affect it. And so it does become a little bit of a Sherlock Holmes situation, trying to figure it out. In minor homocysteine elevations, usually it's the B12. And we start with that because most people, the other factors, folate and vitamin B6, the most well-known factors, are usually under control. Most people have those normalized. So then we want to kind of double down on the B12, make sure they're getting it, and then retest. And if they're still elevated, there's still some tricks up our sleeve. We can test a specific amino acids. There's something called, if people are getting too much methionine. Methionine is predominantly a protein in animal proteins. But that's one of the parts of the workup, amino acid workup. And then there are some supplements that you can try, something called betaine and creatine. Creatine is another supplement that people will try and then retest the homocysteine. And why go through this? Why go through? Well, it's problematic. The homocysteine is somewhat inflammatory. And so if people have persistently elevated homocysteine, despite double checking the B12 and making sure they're taking the B12, then you should kind of go through the workup and you should try to treat it with a supplement and then periodically retest once a year once you get it back down to normal.
Cool. Thank you. We've got a question on Instagram from Lisa, and it is, where did it go? It just moved. Okay, it's about elevated lipoprotein A. You kind of talked about that, but she says, my husband's already vegan. Is there anything he can do to minimize the effect?
People have tried niacin, and there are medicines. Niacin is the kind of the primary thing that people have used to try to decrease lipoprotein A. However, niacin has kind of fallen out of favor, and that's because it's could potentially increase your insulin resistance. I believe it may have some effect on increasing arrhythmias, and so the nail is kind of in the coffin for niacin. It keeps coming back. Niacin keeps, because it used to be a big thing in the past. So once again, the shift is from sort of treating lipoprotein A directly. They're working on medicines, but when they come out, they'll be like zillion-dollar expensive medicines. They don't have a medicine out yet. But if your lipoprotein A is high, then what you do is you shift the focus onto the LDL and ApoB. These particles are atherogenic. They clog the pipes. So switch to what you can control. And you can take medicines or supplements to try to decrease your LDL ApoB. Some of the supplements are amla powder. Amla powder, it's mildly effective. The study that said it was as good as a statin, I don't know if I believe that, because in my patients, it doesn't seem to be as a robust response as what I'm hearing in the studies, these two small studies. And amla powder. The next one is berberine. Berberine is a supplement that can decrease LDL, and it's supposed to be pretty robust, 20 or 30 points. And you take, 1,000 to 1,500 milligrams of berberine extract, and it's supposed to decrease absorption, decrease production of LDL. So this is an option for supplemental non-statin medications. So with LDL, with LDL and lipoprotein A, what if people have elevated lipoprotein A, what they recommend is a lower threshold for anti-cholesterol therapy. So there's a database based on the Framingham studies that tell your risk for heart attack in the next 10 years. So it's on the American College of Cardiology website, ACC risk calculator. You would type it in, Google that, ACC risk calculator, and then you can put in your factors, and it'll tell you what your risk is for a heart attack in 10 years. If your risk is 10% or greater, the American College of Cardiology recommends cholesterol medications, statins. If you have elevated, the way you handle the lipoprotein A is that if you have elevated lipoprotein A, you lower that threshold for treatment to 7.5%. And that's kind of how it's handled. Because you have an additional risk factor for clogging the pipes.
Thank you. The person with the blister wrote back and said that they saw an acupuncturist last week, and then it was heated. Next day, a blister formed, and the dressing caused it to burst.
It sounds like it might be some sort of burn, like a thermal burn, or I don't know if there was some cupping involved or something like this, but it sounds like an injury, or maybe it was potentially some sort of topical thing that could cause an acid burn or some sort of blistering. Or, with acupuncture, if they put needles in it, there could be like sign of infection. Infection would be spreading redness, and in spreading redness is cellulitis. You can also get blistering a little bit. But either way, if we think it's a thermal burn, a thermal situation, then we assume that this is going to be self-limited. It's not going to spread or go anywhere. It's just that area. Super painful, super painful. So what I recommend is covering it and using you can go and you can get these kind of large gauze type bandages with non-stick pads, non-stick surface, and you use Aquaphor Vaseline on the open part of the wound so that it's sealed, basically. You seal. What you definitely want to do is avoid Neosporin. Avoid Neosporin. Neosporin, only give Neosporin to your enemy, like chuck it over your friends if you don't like your neighbor, because
give them while giving them a smoothie with bananas and blueberries in it.
Yes, give them this, man. Yeah. Neosporin is like the biggest kept secret, and it turns out it is a lot of people are somewhat allergic to it. It causes contact dermatitis. So yeah, it causes redness, itching, and burning, especially after a couple of days of use. So, but instead, just seal that wound up with some Vaseline or Aquaphor and use a non-stick pad so that it doesn't get, brushed up against, or, you don't further injure or cause any damage. And you want to avoid soaking and avoid swimming and soaking while it's healing up and closing up. Once it's closed, you can shower, and soak and all that.
Thank you. And then Lisa, whose husband had high lipoprotein A, says it's at 145, and that she read that metformin, it can reduce it. Is that true?
Maybe so. I haven't heard that. I haven't heard that. Right now, I don't think that there is a well-known accepted treatment. And so maybe there is an effect. I've actually heard that statins potentially could mildly increase the lipoprotein A, but I haven't heard about metformin. Metformin can play havoc on your inside. Sometimes it makes people have upset stomach or looser stool, and a lot of times with cholesterol and things that make you kind of pass things faster, like fiber, for instance. Fiber lowers cholesterol because you reabsorb less of the cholesterol in the bile.
Nice. Thanks. Okay, here is a question from Deb. Dr. Harrington, what causes the homocysteine levels to be high? Mine is 11.7. My B12 is 440. The doctor wants me to take folate acid supplements. I eat whole food, plant-based, no oil, usually a green smoothie and salad every day. Have had low sodium, but got that up by drinking less water.
Okay, so that's funny because that brings up the low sodium thing. Yeah, so sometimes they'll have people actually, be on water restriction, which is another, seems kind of crazy, but that is one of the treatments once they go through the algorithm and find it. But back to the homocysteine question. Yes, so homocysteine is multifactorial. Now, most people aren't low in folate unless they've had severe alcoholism and they're not eating any kind of plant matter, right? So as a vegan or plant-based person, it's very unlikely that you have any type of folate deficiency, and that's a simple test. They can do a simple test on your folate and find that you have plenty of folate. So you don't have to worry so much about folic acid supplementation. Folic acid supplementation, they've kind of poo-pooed that and switched to folate as opposed, actual folate forms and things like prenatal vitamins and everything. I had not seen the research, but it had gotten a bad rap for potentially having side effects. So they're switching to folate specifically. Now, you get folate through foliage, the green plants, greens. So once again, I don't think that is the case. Now, what causes homocysteine? So B6, low B6 can be a problem. Another one that most people tend to not be low in B6. In fact, lately in the alternative medicine community, there's been a lot of hype about people overdoing B6 and causing things like numbness and mental fog and things like that. So if you kind of have unexplained symptoms and you take a lot of vitamins, check your B6. So then there's this thing. So there's B12. Best thing to do is to up your B12 and retest in 8 weeks. And if you're not trending down in the homocysteine, then you want to do the homocysteine workup. Why not just go straight to the homocysteine workup? Well, it's kind of expensive. It's kind of, homocysteine is one of those labs that is not like, written typically in the normal panel. And so you'll find that it's expensive. Sometimes insurance doesn't cover it, so it becomes an issue. But once you've proven it beyond a shadow of a doubt that it doesn't seem to be the B12 and all this stuff, then I would get some testing done. So the test includes something called plasma amino acids. And then, you want to definitely get the MMA, repeat the homocysteine. And then there's even stuff like MTHFR testing. People have genetic problems with that allow for homocysteine to build up. So these are some of the things that you're going to want to test, and you want to kind of go back. And then if you never really figure out the cause, one thing to do is to try to drive it down with other in the metabolic pathway of homocysteine. There's something called betaine. Betaine could be a limiting factor, and creatine supplementation also seems to drive down homocysteine. But I'm not saying for people to be on these supplements for their whole life. I just recommend, getting on, taking the supplementation, seeing your homocysteine go down to normal under 10, and then, rechecking like once a year.
Thanks. Apple, who's watching live. Hey, Apple, nice to see you. She's asking if there's any suggestions to relieve neuropathy. She's not diabetic or pre-diabetic.
Well, you want to figure out the cause. Neuropathy sounds horrible. Like it sounds like it would be horrible to have to deal with this. Pain in the nerves. You can't run away from it. You can't rub it away. You can't, and so it's just there. So you want to see if there's a cause. So a metabolic cause like B12 deficiency, or a mechanical cause where you have discs pushing on a nerve. Or the blood sugar, diabetes. If you have really bad diabetes, you have the microvasculature that supplies the nerves become damaged, and the nerves start to die. So find out the cause and see if you can stop the progression. Usually that's what you can hope for, is to stop the progression and go from there.
Thanks. Then we have a question from another live viewer named Patty. Is there anything that can mitigate essential tremors?
Essential tremors is tough because it's kind of at your baseline. It's at your baseline. We tend to get it as we get older. And some people have really dramatic essential tremors. So I think we're all kind of going to experience a little bit of this essential tremor at some point in our life. But there are some things that can, mitigate it a little bit. And these are things like making sure you're getting good sleep. Essential tremor can be worse after things like workouts and, where you're really exerting yourself a lot. Caffeine and stimulants are another thing that can really exacerbate it and make your essential tremor more coarse, they call it, coarse. And so it's one of those things that really starts getting you worried, if you're constantly having a little bit of a fine tremor like that. You're going to want to talk to your doctor, make sure they don't think it's anything worse than essential tremor. But it's one of those things I try to, normalize and like, oh, we're all going to get that. Don't worry about it. But yeah, so definitely have your doctor check you out, make sure it's not something worse. But this is something that kind of happens to most of us.
Thank you. We Celebrate Eating Plants wants to know if you ever share your skincare routine. Guess you must have nice.
Oh, no, I don't have a very special skincare routine. But it's funny. My daughter, she's got an amazing skin routine because she's watching all these videos and she's really into it. But I don't use any retinoids. I don't use any retinoids or serums. But when I do go out, I try to remind myself to put on a sunscreen. Some people will do it, just put it on daily, no matter what. So they're getting avoiding sort of ambient light. But I don't have a specific routine. I only use a mineral-based sunscreen when I go out.
Nice. Thank you. So do you know all about the thing and how not to age, about not to use the retinols,
Yeah. So yeah. And how not to age. Yeah. So there was the previous studies in retinols had higher rates of mortality with people using like skin treatments. But they didn't really give, they don't know why. And so it doesn't, I'm not sure if I mean, I'm not really concerned my patients are going to drop dead if they're using retinols. But I don't push them for that sort of reason, because it's kind of out of the blue, kind of confusing. But the biggest problem with the retinols is that people, when they ask for the retinols to be sort of longevity and wrinkle cream type medications, problem is that they're usually prescribed at too high of a dose. And when you use them, it can cause redness and flaking and burning. And so the goal is to use them at night away. And the goal is to use the lowest possible dose. So like a 0.025%. I think I'm saying that right. You want, a typical might be like I forget the dose right off the top of my head, but you want to use like a quarter dose. And start there, because the medicine causes redness and burning and flaking, and it can be problematic.
Thank you. Mary says, I was told you shouldn't take berberine long-term, yet I have a friend who's been taking it for years. Is there a long-term danger?
That's a good question. I have not seen long-term studies. I think the studies I've seen have been short-term. And I mean, anything's possible. And see, I like those two for the cholesterol, the amla powder and the berberine. Amla is kind of nice because it's just fruit powder, where berberine is an extract of various things like golden seal, Oregon grape, and barberry, and various things. Usually when it's in the pill form, it's an extract. It's a little bit more problematic than just getting it from a whole food. But I think you can get it from barberries, but I just don't know about the dose.
Okay, great. Thank you. A doctor blog, Florence, says that you should not use alcohol or hydrogen peroxide on wounds because it kills the beneficial cells that allow for healing. Do you agree?
Yes, 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 yes. I totally agree with that. So I imagine that you have the cells are trying to they're trying to grip hands, they're trying to cross the chasm of the wound, and things. That's why we don't recommend the letting a wound dry out anymore. Like, oh, let the air get to it, let it, let it get the air to it, because it creates a big scab over it and can like sort of prolong the healing time. So the goal is to kind of seal it up, but not with a water dressing, with an anhydrous dressing. So it's Vaseline or Aquaphor, so that it just seals it, but it's not a watery environment. But it allows the wound to not dry out, and it allows those cells to migrate and create a matrix to have rapid wound healing. So cover it, seal it, and use a non-stick dress.
Thanks. Okay, the next question, and thank you guys for putting 4 question marks first. It helps me differentiate a question from a comment. Jill says, what causes the lower number on the blood pressure reading to go up? And if you want to go over maybe what the numbers mean and things like that.
Yeah, so the top is systolic. That's the squeeze, the end of the squeeze of a lub-dub heart pump. So the ventricles are squeezing. And the diastolic is the ambient blood pressure, the blood pressure of the blood vessels in the system itself. So things like stress, things like sympathetic tone, where the vessels are all squeezing down. I assume things like salty meals causing a additional volume overload could raise it up. So, but if you have like significant abnormalities in the diastolic, especially if you have a lower diastolic, that doesn't make sense. I recommend people get an echocardiogram. An echocardiogram can tell you what the valves are doing, what if you have any mechanical problems with the heart, or signs of long-term blood pressure and thickening of the heart muscle inappropriately. So stress, sympathetic tone, volume overload due to salty foods and things like that are some of the factors.
Okay, thank you. Let's see. You're welcome for the great information, Cheryl. And Florence says, I'm not sure what SIAP means. Is it okay to start with SIAP and water fast? I don't know what SAIP is. SIAP.
Google time. Maybe it's syndrome of inappropriate antidiuretic hormone, SIADH.
It looks like SIAP is what was typed. Huh.
Google to the rescue. Let's see.
Does that mean anything to you? And Florence, if you're here, maybe be a little more specific. Everything is like an acronym, isn't it? Or a very hard to pronounce word.
Yeah. Sorry if already posted. Sorry if already posted. Maybe
oh my gosh.
This is
wow.
This is
See, you really do. I learn something new every day on the show. Wow.
Sorry, if already posted. Yeah. So what was the question after that?
Okay to start with and water fast. Sorry. It start with what? Can you be a little more specific? We have plenty of time. We don't have to just have acronyms. So please be more specific about that, Florence. Soap. Is it okay to start with soap and water fast? Now that makes even less sense. You got to be a little bit more specific. Please type in complete sentences and we'll get on to the next question from Sonia. As a vegan, my HDL is very low. What can I do to balance it out? We get this question a lot, and the way Dr. Clapper explained it is when you don't have garbage, you don't need garbage trucks.
That's a great analogy. Yeah, I'm not so worried about HDL. I've sort of drank the Kool-Aid on this one about not, gone are the days where I'm worried about your HDL. And I think the nail in the coffin for that one was when they developed a medicine that increased your HDL, and it didn't seem to help with mortality and things. So if you lower your overall cholesterol, HDL is going to be lowered as well. I guess you'll hear people talk about your triglyceride HDL ratio and its relevance to insulin resistance. And that is something I see a lot in my vegan patients, because it seems like triglycerides, these pesky triglycerides, are being up, and relative to HDL is kind of high. So yeah, I would, if your overall cholesterol is low, I would not lose a wink of sleep about your HDL.
Thank you. And if I want to see if Florence came back with her esoteric question about soap.
I don't recommend soap and fasting. Don't recommend
Actually,
it.
they don't even let you take a shower when you're at True North. Okay to start with soap and water first. Okay, start what? Maybe she means on wounds. Okay, I don't know why. Just type a complete sentence, please. Maybe she means on wounds.
Probably on wounds. We talked about wounds a couple times on here. And let's just kind of open up the can about wounds in general. Yeah, when you initially have the wound, I recommend kind of rinsing, and I guess a little bit of soap couldn't hurt. But the caller that had mentioned the alcohol and the hydrogen peroxide, yeah. So over time, as it's starting to heal up, you can sort of go backwards a little bit by scrubbing too hard, or in a superficial wound, scrubbing too hard and using caustic substances on it. You can kind of prolong the healing time. Now, if you have a very deep wound, that starts to develop necrotic tissue, then you need to be followed by a wound care specialist who are surgeons, and they will literally scrape away dead tissue and stuff like that, so that you can continue to have rapid healing, making sure you have blood that is tissue that's viable. So if you have a fairly large wound, or it's an area like on your arm, hands or legs, not very central, that is going to be problematic and take a long time to heal, you want to have a wound care specialist. I couldn't value that high enough. In terms of another thing is that people will get wounds like bed sores and wounds on their feet, and it can be related to blood flow and lack of blood flow, or peripheral vascular disease. In these scenarios, you're wanting to maximize the blood flow and avoid things that block the blood flow. You have to, sometimes people will inadvertently cross their legs, and they'll block the blood flow on the wound, like in the back of their leg or something. And so you really have to manage that, watch that. Like people have, sometimes after a surgery and they're sitting down for a long time, they can literally get a wound on their backside. And in those cases, you have to have them flip over and that kind of thing. So blood flow is a big deal, diabetic management. And then when you have a superficial wound, it's avoiding slowing down the healing process by not traumatizing it, not putting caustic chemicals on it, and sealing it up and covering it.
Okay. So that's, people always want to know, do you cover a wound or do you leave it open?
Yeah, cover it up, seal it up and cover it.
Yep. Okay. We only have a minute or so left, so I'm looking if there's any great questions. I am not seeing any. Aren't you doing something, an upcoming speaking job somewhere? I don't know. I thought I saw something.
No, I'm up for that kind of thing, of course. Always enjoy teaching and that kind of thing. It's been great doing these Thursday talks. I really appreciate it, Chef AJ.
It is so fun. But listen, I'm not going away forever. I'm just taking a hiatus, guys, for about 4 months, because I got a new book and my publisher's got me running between July 1st and the end of October at the very, very least. So we're not going to be doing the daily show. June 30th will be the last one with Dr. Furman. And then I'll be doing maybe one show a week, maybe two if I can find time in between my appearances and all. He's got me doing all these podcasts, which is good, but it's a lot of work.
I can't wait to see it. I can't wait to hear your podcasts.
Thank you. Other people's, like, like Rip, and I'd love to get on Rich Roll again, but who knows if I can get on a third time, but I'll be doing some big ones. Let's see, here's a quick question from Florence, who typed out a whole question for us, which is, since B12 lasts 5 years in your system, if your B12 level is okay on a blood test, why still take the pills several times a week?
It does take a long time to develop B12 deficiency. And so the biggest thing that I get worried about, and maybe this is fear mongering. You hear things like people like Goldhammer, he didn't take it for years, and kept testing and found out when he started to decrease it, he started to take it. I think that's the lore about that.
It took a long time.
Yeah. And so, but I worry about this sneaking up on us, I guess you could say. And so I recommend daily. If you're under 65, I recommend daily 500 micrograms. If you're over 65, I recommend daily 1,000 micrograms. So
really, how come you recommend more for us elderly folks?
Well, they shaded that the absorption is a little bit more is less. So.
Is it less than when you have a banana and a blueberry together?
I know. I think that like sends you into the unhealthy vortex. If it includes a banana.
You have a great sense of humor. Thanks for playing along. Okay, one more question, because it's a good one. This will be a good one for Dr. Furman too. But how does the brain change after years of obesity? Asks Carolyn. Do these changes make it harder to lose weight?
Yeah, well, that's the debate. And, I hear rumblings about this. Of course, you hear rumblings about metabolic changes, leptin resistance, hormone, like the normal hormone milieu that's supposed to make it so that you feel full and curb your hunger. And there's concern that you have, changes that can make it harder for people who have been overweight for a long time to lose weight. So in spite of that, though, it's like, what do you have? This is kind of a poor analogy, but it's like, if you're bad at math, but you're a student, you still have to do math, still have to work on it. You may have to work on it harder. There could be some things that you're working against. It's to acknowledge how difficult it can be, really. That if you've been very obese, that you can be working against some of these factors, but that's no reason not to give up. I guess throw up your hands. It's reasons to sort of be even more concerned about eating under the influence. Eating salt, oil, and sugar and addictive foods and these kind of things, and being more vigilant and more acknowledge how food can have drug-like effects. That's the way I would treat it. I don't have more specific instances of things, changes in the brain to enlighten you with, but I have heard that this is a fact.
Thank you so much. It was a wonderful Q&A.
All right. Thank you, Chef AJ. It's been a blast.
Oh, it's been great getting to know you. And thanks all of you for watching another episode of Chef AJ Live. Please come back tomorrow at 11 a.m. Pacific time. I'll be talking to the co-founder and 44 years CEO of Whole Foods, John Mackey, and we're going to talk about his new book, The Whole Story. Do you have a Whole Foods where you live, and is that where you shop?
Yes, I use Whole Foods. Absolutely. Absolutely.
Yeah. Well, good. You use Whole Foods and you eat Whole Foods.
That's true.
All right. Take care, Dr. Harrington. Be well.
All right. Chef.